Last question, then I'm going to open it up to everybody.
Sure.
So all of our attendees are middle school to high school range. What is something that they can start doing now to kind of get them prepared into the field of radiation therapy?
In high school. So what they would need to do is concentrate on math. Math is incredibly important and it's a requirement for the program. We use a lot of math in our physics courses, so a person needs to get as comfortable with math and begin to love it. And sometimes people don't love it, but you have to at least appreciate it and become technical, have a certain skill level there. Physics is important in radiation therapy, so if you can get to a physics class, that would be very important. Biology, incredibly important, because that's where cancer rises, is cells that are in the body. So, and then when we treat patients, we have to know the anatomy. And I mentioned earlier about the images that the therapist evaluate each day on the treatment unit. They have to know anatomy and what it is and where it's at and what it looks like on an x-ray or a CT. So biology, anatomy, and physiology would be very important. And those would be kind of the hard sciences. Chemistry, is good, and it's very important in the A&P classes, anatomy and physiology classes that are in the first year of the program. But science-based classes, I think, would be very important because we assume all the English and all of those are going to be happening anyway. So that's what I think would be helpful. And if a person could volunteer in some sort of a healthcare setting, I think that would be very good. The sooner a person is able to be comfortable with another person in a very healthcare related intimate setting, the better. So I think that would be very helpful to someone if they could do that. They could volunteer at a children's hospital potentially. They could volunteer at a hospice. There's all kinds of volunteer opportunities, maybe not as many right now with COVID, but hopefully that'll change in the near future and people can get back into volunteering. And I think that would be helpful. I think it would just help with understanding. And just a quick little aside, when I was in high school, we had candy stripers at that time, and I became candy striper. And they put me in various places in the hospital, and I didn't work out at any of them. I was very, I empathized too strongly with the patients, and I was in tears half the time and whatever. So finally they ended up putting me at the front desk that I just saw people as they walked through the door to go visit the patients. So one would never think that I would have ever been able to work in a healthcare related setting based on how I was initially. But I grew and I matured and I became better. And I think sometimes that's a process for some of us, and it was for me. So I think that volunteering piece would be helpful to many people.